Good. Good afternoon, everyone. Thank you for joining us here today for this historic day for our city. Today, we will be committing to a community-based diversion approach with the goals of improving public safety and reducing unnecessary justice system involvement for those who participate in these new high-quality diversionary opportunities. Today, you will hear from Camila Alarcon from OCHS, Chief Larry Scarato, Public Safety Director Lee Schmitz, City Councilman Bobby Wilson, Mayor Ed Gainey, and some others. And then after the formal speaking portion, there will be a signing ceremony of the MOU. And then after that, we will take your questions. For those of you who have questions beyond the topic at hand, I ask that you hold those until all questions about the other topics have been answered. It is now my honor to welcome Camila Alarcon from the Office of Community Health and Safety.
Thank you so much, Maria. Good afternoon, Honorable Mayor Ed Gainey, Councilperson Bobby Wilson, Chief Scarato, Deputy Mayor Jake Pollock, Chief Frank, Director of Public Safety Lee Schmidt, and the esteemed guests of the Lead Support Bureau. For the past 2 decades, Sergeant Bristow has been advocating for the implementation of a diversion program for our city, one that can bridge the gap between police and the communities that they serve. Today, we are here to finally launch the Law Enforcement Assisted Diversion program through the Office of Community Health and Safety, which has been tasked to serve marginalized communities that have been systematically isolated from society and victimized by an unjust system. For the past 3 weeks, we have piloted a soft launch of this program and have already seen the need and the positive outcomes benefiting those who are unhoused, experiencing mental and behavioral health challenges, who use drugs, who are in active drug use, and are in extreme poverty. Starting today, this program will be officially launching in Zone 1 and 2. It is important to mention the support that we have received from this administration, not only to develop the program, but also securing funding that will make it sustainable. We thank the Office of Senator Casey through his community projects, as well as the U.S. House and Senate Committee on Appropriations to the Office of Justice Programs and the Bureau of Justice Assistance. This program will provide the necessary services to ensure that people can advance with dignity and feel welcome back into their communities. It is my pleasure to introduce Tiara Bryant, Deputy Director of the Purpose, Dignity, and Action Program and the Site Advisor for the Lead Support Bureau.
Thank you. Good afternoon, everyone. My name is Tiara Bryant, and I work for the Lead Support Bureau. I have my colleague here with me, Brendan Cox. And the Lead Support Bureau provides technical assistance to jurisdictions across the country who are implementing LEAD programs or expanding LEAD programs. And since launching in Seattle in 2011, LEAD has expanded to over 100 different jurisdictions across the country. We've been working with the City of Pittsburgh since 2019 to launch here, and we are excited to partner with the City of Pittsburgh. We're excited about the opportunity to provide an alternative response and an extra tool to law enforcement to address unmet behavioral health needs, poverty, and substance use disorder, and people who are engaged in problematic behavior as a result. Thank you so much. It's a pleasure being here, and we look forward to the continued partnership with the City of Pittsburgh.
Thank you. Now it is my honor to introduce Chief Larry Scarato, who's been crucial in the support of the Public Pittsburgh Bureau, not only for this program, but for our office. Without his buy-in into these important programs that benefit the community, we wouldn't be able to launch. Thank you.
Good afternoon, everyone. I said this earlier, and I think it's worth repeating. You know, it's easy to stand behind a program that you believe in. And I believe in LEAD, its objectives. I believe, in its principles and its visible outcomes. A lead initiative for the city of Pittsburgh is a police-led diversion model intended to direct people whose low-level offending is associated with behavioral health conditions or other social challenges, whether it's chemical dependence or unhoused, that will weigh heavily on police services. Lead programs are meant to reduce recidivism through case management and the development of individualized strategies to address participant needs. The key elements of LEAD include collaborative partnerships, officer discretion in referral, and intensive case management. The LEAD initiative will have a reduced number of 911 calls to free up officers to focus on what we say are the Bureau's priorities, and that's reduction of violent crime, specifically gun violence, building community police partnerships, and improving the quality of life for the community, for the citizens of Pittsburgh. This is an essential function for us, especially as we face manpower issues with staffing and the likes. It will also improve relationships between law enforcement and community, improving our officers' wellness by providing them with a resource, an outlet to actually do good in the encounters in which they come upon or become involved with our citizens. So again, I think it's worth repeating. This is a worthwhile effort that the Bureau supports. We thank OCHS and Camila's team and her partnership, LEAD and your team and your partnership, a worthwhile venture that I think will benefit the city, benefit our community, and more importantly, benefit those that may be the most vulnerable in our community. So thank you.
Thank you, Chief Scarrato. Next, I would like to introduce a leader, a mentor, and a great supporter of our office, the Director of Public Safety, Lee Schmidt, who has really trusted in the subject matter experts to really develop strategy, policies in favor of all our most vulnerable communities.
Good afternoon, and I want to thank everyone for being here. I want to thank the Lead Support Bureau for all the diligent work, working with both the city and the county over the years. It's taken some time to get all the collaboration needed between the city, county, the court system, DA's office, public defender's office, multiple municipalities surrounding the city, the connect communities that the county's been working with on this. It's great to see this program officially launch within the city of Pittsburgh. It's great to see, as the chief said, another tool in the toolbox for our officers to engage with the community. As I've said to folks before, I never believe that anyone in public safety gets into public safety to do anything but help the people that we serve. Sometimes we don't always have the tools necessary to do that. Our officers don't always have the tools necessary. A quick story that officers told me a while ago is about a mom and a daughter who they got called to a store for shoplifting. When they arrived, the daughter had a couple pounds of ground meat and a frying pan in her backpack, and the store manager wanted them charged with shoplifting. The officers quickly realized that it wasn't a matter of them stealing that to resell it or because they needed something. It was because they needed those things to make dinner that night. At the time, our officers luckily had our co-response team to give them some tools to help these folks. But that engagement happens more often than anybody wants to believe. There are people experiencing poverty, homelessness, drug substance use disorder that need help more than they need incarceration, more than they need charges brought on them, which will just make their situation worse. Low-level infractions like shoplifting, nuisance calls, typically are a cry for help and a cry for support. Programs like LEAD gives our officers a tool in their toolbox to work with our Office of Community Health and Safety to get people services they need to get housed, to find housing, to find rehabilitation services, and to find programs that can help them with their poverty needs. When it comes to behavioral health issues, studies show that substance among lead participants increased substantially. Employment and income benefits increase when they're involved in a lead program. This provides a case manager that follows these participants through the program to ensure their success, and constant communication between the officers, the DA's office, the public defender's office, the court system to ensure success. And when people fall out of the program, ways to get them back into it. So again, I want to thank Camilla and her team for the diligence over the years, bringing this to fruition. And again, the Lead Support Bureau, as well as our chief and mayor, for all the fruition. You for funding we just found out about today. So thank you very much.
Thank you, Director Schmidt. I would like to introduce Councilperson Bobby Wilson, who will be one of the council members that will have the program piloted in his district, and who we thank for his support of our office.
Thank you. So this is my second press conference with the mayor today. The first one was about building a new bridge in Riverview Park. I have to say that this isn't all that different, because with your leadership and also with your collaboration, everyone's collaboration here, we're building a bridge for people to have a better life through diversion. So I think that it's a very important moment for Pittsburgh and for all the efforts that have been going on for some time. I remember when we took a walkthrough with everyone that was involved with conversations back in 2020, whenever I took office. And it's great to see that, the leadership really, pulled through on this one, because just looking at all the people in the room and all the different entities takes a lot of collaboration. And that continues to be an example of this administration for a lot of, all the collaboration that happens. I want to make sure that I recognize that although people continually say, people will say, you should help people upstream first. And you should continually help them with housing and education. And here in the city, with the collaboration of the administration, we continually pass legislation that does so, tries to support housing, and also with outreach on the streets. I've been, I've had the honor of representing downtown in the past couple of years here in District 1. And, to see the outreach teams out in the streets, making sure that people have the right people to talk to, that are, whether they're getting out of school, or they're trying to catch a bus home. I think that, we continually see the efforts of all of us here trying to help people upstream. And this program, although it is a diversion program, we are using this tool to make sure that people do have a chance at a better life and to make better decisions and have the resources to do that. So looking forward to this collaboration and proud to have it in District 1. Proud that this will be implemented in District 1. So thank you, everyone, for making sure this is happening.
Thank you so much, Councilperson Wilson. Next, it's my pleasure to introduce the Honorable Mayor Ed Gainey, who has supported and advocated for this program since he took office, and we're finally able to launch it today.
First, I want to recognize Councilman Daniel Lavelle, who is also part of this, who could not be here today because he's at a URA board meeting. So I do want to recognize the support that he has for this. I also want to recognize my Deputy Mayor, Jake Pollock, my Chief Operating Officer, Lisa Frank. I want to recognize both of them for the work that they do. I also want to recognize our Bureau of Police, our officers who's on the street every single day, helping us every single day to make this city great, dealing with our homeless or the ones we got mental health. I just want to thank you, and I appreciate you so much for that. Community, I also want to thank you. A lot of questions around our office when we first came in about what we were going to do and how we were going to do it. And I think as you take a look around, you've done an incredible job of changing the whole character and the whole perception of the office. And this could not be possible today if it wasn't with your help. So with you, I want to say thank you. And to my public safety director, I appreciate you. I appreciate the effort that you put forward. And I want everybody to know just how diligent you've been on trying to make sure that this lead happens. I also want to thank, I want to get it wrong, the Lead Support Bureau. I appreciate you being here. It means a lot. Not to just talk about something, but to actually show up and support it in person. To me, that means a lot because it means it's more than just words. It's really about the deed of how we save people. And I want to thank you for being here today. Councilman Bobby Wilson, I want to thank you. When I was going through the process of running, we had met on the north side at a restaurant. And you had continually talked about the outreach program to the homeless, the unsheltered, and what we had to do to continue to create tools to make sure that we was reaching the people that was the hardest to reach. And I think this LEAD program is one of the ways that we put in the toolbox that helps us to do that. So before I begin, I wanted to say thank you because I think sometimes we look at one office and say, wow, look, the mayor's office made it happen. And when I'm trying to tell people that if you don't have a collaboration, different organizations and entities and departments, we can't make nothing happen. It's only when we come together that we can make something happen. And I want to make sure that everybody recognizes that. I also want to say 2 years ago, we unveiled the Pittsburgh Plan for Peace. We talked about the need to create a high quality, real diversionary program that really spoke about the needs of today. Today, because of the hard work of OCHS, our public safety director, our chief of police, we are here to say that we are following through on that promise. Promise made, and again, promise kept. Our vision with our LEAD initiative is to provide people with a client-based approach that provides those suffering from addiction or criminalization, mental health, and people that we know that really need our help that we centered upon. LEAD is that tool that we need that we can put into the toolbox to help us out. And I can't say enough about how many times we have created new instruments that help us build a city for all. To provide an opportunity to no matter if you fell on hard times or you're going upstream, that there are tools for you that you can use that can really help you get there. And we never look at somebody and say, oh, wow, that's a problem. We look at them and say, how can we create a promise that we can help them get the help that they need to help them live their life? That's how you create a society where everybody gets better. By having multiple tools in the toolkit so that as we go forward, we can use all of them to help people. No one size fits all, but together, there's something in that toolbox that can help you. And as many people as we can help, we want to help. That's what diversionary is about. And so I believe in this program. I support this program. We will be instrumental in making sure that everything that we have to do to get this program up, running, and executing at a full pace, we will do. We have never came to you and said, listen, here's something that we think about doing. Everything we said we would do, we've done. And that's because we want to make this the best city in America. And we have the ability to do that. And with this new tool that we call LEAD, it's a continuation on the move that we made, creating a city for all. Thank you.
At this point in time, I would like to ask Mayor Ed Gainey, Councilman Bobby Wilson, Public Safety Director Lee Schmidt, Chief of Police Larry Scalado, Chief Frank, and Deputy Mayor Jake Pollock to the table to sign the official memorandum of understanding about the LEAD program. We'll do questions. Yeah. We always go first. Yeah, come over here, have that.
Thank you. I'm gonna have them come up next. Maria had them come up, yeah. And y'all know, taller, you under 5'4", come up front.
That's why I'm always in the front.
Can we have Lee come on up and join me? Come on. Come on. Come on.
Or lead,
Mm.
yeah.
Come on. Oh, absolutely. Come on.
You better deliver.
Sergeant Bristow.
Hmm?
I'll tell you later.
The Lee ain't got better. Huh? He just come over now. And I'm like, oh, wow, what are you?
We'll take your questions.
Yeah, I'm getting down. Get up, get down. What's the question?
So I'm
What's the
looking at the
question?
crimes on the left here. So is this a first-time offender or all offenders if they commit these crimes? Then instead of being cited or charged, are they being option to enter this program? Is it an option? Like, we just need the logistics here.
Yeah, so these are the divertible crimes that were approved in the policy coordinating group, which the DA, the public defender, county executive, they all approve this. So this is what our officers are going to use. And whenever someone commits a crime that fits this criteria on the green, it's discretion to the officer. So they still have the discretion. They make the decision. And so if they decide that this person is suitable for lead, they can do a warm handoff. So that means they call a case manager. The case manager goes to the scene, and that arrest never happens. That charge is completely erased. However, for example, if there's a victim, like if there's retail theft, the victim always has to agree as well to make sure that they can go into this program. That doesn't mean that if the person reoffends, they can still get charged again, and we still will work with them. In our soft launch, we've gotten some referrals that are currently in jail, and we're working still with them. So we're gonna launch with some social contact referrals, because the great thing about this program is that it's preventive. So our officers are constantly engaging with people, they know them. So before they get to the point of committing the crime, they can refer them to our program. So we're doing that through our co-response unit and through the different patrol officers in Zone 1 and Zone 2.
How does the program work? Is this, how long is it? And
Yeah, so this program is based on intense case management. So that means that the case manager is accompanying that person through all of the processes that they have to go. It's person-centered, so the person decides its goals. You don't have to be sober to be part of this program. It's not punitive. It's person-centered. And the beauty of it is that you never graduate. So what does that mean? That person can be housed, can be doing great. We can find them jobs. We can get them into a program where they go into rehabilitation. And let's say in 2 years, they experience something traumatic, something changes, they can just reach out to their case manager. So that's something that's different from other case management programs, where you don't graduate until you feel comfortable enough to be back in your community.
Justin, you have a question?
Can you discuss the financial terms? You mentioned sustainable funding. I know
Yes.
sort of we've made allusion to funding from the federal government. Can you specify what this will cost and if you are physically adding bodies? Like if they're,
Yeah.
are you hiring more people?
Yes, so we received the opioid settlement fund, which we were able to hire our first 3 case managers. So the beauty about LEAD is that it also cuts resources on the taxpayers, because you're not clogging up the courts and the jails. But for this program specifically, it's all been funded sustainably through grants. So we hired 3 people. We just got news recently in the past 2 weeks. We got $750K from community projects from the Office of Senator Casey, and just Kismet with the launch, we just got a grant that we had applied for 2 years ago. That will be over $900,000, so we can hire more case managers. And we can expand to other other zones in the city. So our goal is to have full coverage of the city eventually.
You mentioned the hiring people. You also had mentioned that this would help people who are dealing with housing issues.
Yes.
My understanding of LEAD is that there would need to be a quick handoff, like, instead of there being a charge, here's the bed, here's the treatment. How does the city plan to be able to ensure that kind of quick handoff?
So the handoff is not between the police and services. The handoff is between the police and the case manager. So the case manager helps the client participant afford and navigate the systems to get housing, or it depends really on what their goals are. So we've been working with a case that had been a really hard case downtown that was receiving a lot of public safety calls, engagements, and they had gone through different programs with the county, different programs with our office, and the lead case manager started working with them. And it started with basically a cup of coffee and a conversation. It then evolved to a pair of shoes, some clothes, just giving back the person dignity. That person had received 15 citations in one day. They have not received a citation in 3 weeks. So the case manager is an advocate for people who have completely been excluded and marginalized. So that's how we see a lot of these successes. We obviously work very closely with DHS. The county has its LEAD program. So we collaborate very closely as social services are housed in the county.
What's your timeline for ramping up into the other zones?
So since we just launched today in Zone 1 and Zone 2, these programs, it's better not to launch immediately into other zones so that we can really learn from them. But we hope that by the end of the year, we can be in Zone 3 and Zone 5, who need a lot of support.
Ideally, how many case managers per zone?
So when we did our grant funding, the ideal pie in the sky is to have at least 4 case managers per zone. And we also, since we got this funding, are exploring of having, as Commander Novosel, who's been very supportive of the program, mentioned someone who could do intake or hands-off during the weekend and during night shifts. So now that this funding allows us to have that as well. Yeah. Camila Alarcón. Camila is spelled like Camilla, but with 1 L, and Alarcón is Alarcon.
Thank you, everyone.
Thank you.